So for my Unit 2 summative project, I chose Turner syndrome to do my report on. So throughout this PowerPoint, we will be discussing the basic science, which includes chromosome location, along with the mutation location and the information regarding the affected protein. We will also discuss the pathology of Turner syndrome, which includes the symptoms, prognosis, who this genetic disease affects, the life expectancy, and whether or not it's hereditary. We will also discuss the genetic medicine, which includes the treatment options for Turner syndrome and how the treatment relates to the basic science of Turner syndrome. So we will begin by discussing the basic science of Turner syndrome, which is really why Turner syndrome occurs. Turner syndrome occurs because of monosomy X, which is the lack of or partial lack of an X chromosome. The mutation occurs during non-disjunction during reproduction and is absent within the individual, the X chromosome being the protein that's absent within the syndrome. The absence of the X chromosome causes many symptoms in the individual since there are a vast amount of protein coding genes in the X chromosome rather than in the Y chromosome. The pathology of Turner syndrome includes the symptoms of Turner syndrome. Some of the symptoms of Turner syndrome include short stature, ovarian hypofunction or premature ovarian failure, low hairline, delayed puberty, infertility, a webbed neck, lymphedema, which is the swelling of the hands or the feet, heart defects, kidney problems, and this image that is in the slide shows some other symptoms of a person with Turner syndrome, which could include brown spots all over the body, rudimentary ovaries, a fold of skin on the neck, etc. So more about the pathology includes the diagnosis and the prognosis of Turner syndrome. An individual can be diagnosed either prenatally, in infancy, early childhood, or in teen or younger years when their symptoms are more mild. And a diagnosis can be determined through a karyotype, which is a blood test. Also, a doctor could tend to lean towards a diagnosis when there are obvious signs or symptoms of Turner syndrome, such as the webbed neck or the short stature. The prognosis of Turner syndrome is overall pretty good because if it's treated early on, the individual will more likely have a normal menstruation, and this would cause less infertility problems. And also, the prognosis can treat the stunted height and infertility. So, the pathology continues by discussing how females are the only ones that can get Turner syndrome through the loss of an X chromosome during non-disjunction. The life expectancy is pretty normal, but is slightly short-lived for those with Turner syndrome because of the associated symptoms such as heart disease. The life expectancy can be increased in those with Turner syndrome by addressing the associated risks of Turner syndrome, such as the heart disease or hypertension or obesity. Turner syndrome is not usually inherited, but is only really present when the monosomy X occurs within the individual. So for the genetic medicine of Turner syndrome, there's not a particular genetic medicine that treats Turner syndrome as a whole, but there are different treatment options for some of the symptoms of Turner syndrome, such as an individual could partake in growth hormone replacement, which could help them grow taller than having the stunted height as a symptom of Turner syndrome. Also, they could take estrogen replacement therapy, which would help them have a menstruation. So the genetic medicine continues by saying how the genetic medicine is associated with the basic science of Turner syndrome because the genetic medicines address the disease and the symptoms of the disease associated with the loss of the X chromosome. Since the loss of the X chromosome produces so many signs and symptoms for Turner syndrome, the genetic medicine can really help decrease the amount of symptoms one has with Turner syndrome. And then we have my works cited, and that's it. Thank you.